Bula Vinaka. Welcome to Sova Ni Bula Quick Reference Guide app version for SOPD Nurse. In this video, we will look at the following features: pre-entry of lab results, checking in a patient, updating the queue, adding vital signs, and reserving the next appointment date. To begin with, we will look at the pre-entry feature. Nurses may enter the lab results up to a week before the patient's visit from the SOPD Plus system. From the main menu page, tap on Reminder. This will bring you to the Appointments page. The appointments are categorized into 3 on the app version. These are appointments due today, appointments due in a week, and those who have defaulted their appointments. Tap on Week to see patients scheduled for the following week. Next, tap on Patient's Info to open the patient's profile. The patient's profile contains demographic details, medical history, which you can swipe through, contact information, as well as the pen color. Tap on the menu icon from the bottom taskbar. The pre-entry option will appear. Tap on it. Next, scroll down and tap on Lab Results. Here we will enter the laboratory result for each lab record that we wish to enter. You may derive the values from the SOPD Plus system. Ensure to have the SOPD Plus system open on your desktop, so you may search up the patient and view their lab results and enter those results accordingly into Sova Ni Bula system. Tap in the search box to start typing the results that you wish to look for. Type in a few letters of the test that you are looking for. Then tap on the required option and click Confirm. Using the numeric keypad, input the test's numerical value. It will then be displayed in the value field. Next, tap on the Submission Date box. This will open a calendar view from where you can select the date that the test was conducted. You may use the arrows to filter through the months. You may also filter through the year by tapping on the down arrow. After selecting the date from the calendar, tap Yes. Repeat the process for entering in the report date. After entering both dates, tap on the light blue Enter button to save the record. You may then repeat these steps until all laboratory results have been entered. Also ensure to sync the file if required by pressing on the refresh icon next to case information. If sync is required, a message will be displayed at the top of the screen that the local file has not been synced yet. Next, we will return to the main menu. We will now look at the features required on the day of the clinic. Step 1. Log into the system and search for the scheduled patients. All patients scheduled for the health center visit can be found under Reminder. Tap on Reminder. This will redirect you to the Today's tab, where you may view the patients that are due for clinic on the current day. Basic details to identify the patient has been given here. You will also see the queue number indicated as per the order of the SOPD numbers given out to the patients at the SOPD clinic. For each patient that has been checked in, there is a queue that will be displayed. This queue is color-coded to indicate which staff has already completed consultation with the patient. The color codes are as follows. Red indicates that the patient is yet to be consulted by that staff. Orange indicates that the staff is currently consulting that patient. Green indicates that the staff has completed consulting that patient. You will note that the diagnosis is also given underneath each patient's basic profile details. The primary diagnosis is indicated in red, whereas secondary diagnosis is indicated in black. To check in a patient, you may use the search feature on the top right-hand corner, or you may scroll through the list and select your patient accordingly. For this example, we will use the search feature. Click on the magnifying glass on the top right corner. Next, enter the NHN of the patient that you wish to search for. You'll notice that there are other fields which you can use to search up the patient. However, since there are many patients with the same first name and surname, it is always best to use the NHN to search up the exact patient that you are looking for. Once you have typed in the NHN, click Confirm. This will show you the exact patient for your particular health center. Step 2. Select the patient to view the patient's profile details. You may view the patient's demographic details, summary, medical history, as well as contact information and pen color from here. Please note, in the summary section, you can swipe left or right to access each type of different history accordingly. Scroll down and tap on Menu tab to begin entering the medical records. Step 3. Check in the patient and update the queue. Tap on Check In. The bar will change to the Checkout option. Next, you will update the patient queue by tapping on the nurse icon, which is given just beneath the checkout option. The color will change from red to orange for the icon, indicating that the nurse has started consulting the patient. Step 4. Assess the patient and enter the triage details. Enter the respective values for BMI, blood pressure, and blood glucose, and tap the Enter button to save. We will begin with BMI entry. Tap on BMI to open the entry. Using the numeric keypad provided, enter the height and weight. After entering the height, tap on weight. Then type in the result from the numeric keypad. You will notice that the BMI is automatically calculated and interpreted as well. Press the Enter button to save. Next, we will enter blood pressure. Tap on the blood pressure icon. You will notice the average of 2 blood pressure readings are taken. For the first reading, use the numeric keypad to enter the systolic blood pressure, then tap on diastolic blood pressure and input the value. Tap the Enter button to save the reading for the first blood pressure. Repeat the steps for the second reading. The average is automatically calculated and interpreted as well. To save the record, press the Enter button again. Next, we will enter random blood glucose. Tap on the Random Blood Glucose option. Simply key in the values directly from the numeric keypad. Tap Enter to save the record. Next, enter the waist-hip ratio. Use the numeric keypad to enter the values for the waist measurement. Then tap on the hip measurement and key in the values from the numeric keypad. The ratio is automatically calculated. Press the Enter button to save. Should there be any other vital sign that you wish to record, tap on the Vital Sign option. From here, you may enter the respiratory rate, temperature, SpO2, pulse rate, as well as any note that you would like to make for the medical officer to consider. Select the result you wish to enter, then click on Confirm. Key in the numeric value, then press Enter to save. To enter any other vital signs, click on Vital Sign again. Choose the relevant record that you wish to enter. Click on Confirm. You may repeat this as often as needed. Ensure to record the triage details in the patient's wellness booklet for their records. Step 5. Enter eye care, nephropathy, dental notes, COVID-19 vaccination as required from reports brought in by the patients. To do this, simply click on the record that you wish to enter. Type in the records by tapping on the blank space provided. This will bring up the keyboard. Enter the notes accordingly, then click on Confirm. For the purpose of this demonstration, we are only entering text. COVID-19 vaccination information may also be entered. Tap on COVID-19 vaccination. Tap on Date to open up a pop-up calendar. Using the arrows provided, select the relevant date. Tap Yes to record the date. Tap on Vaccination date. Next, tap Confirm to save the record. Step 6. Reserving the patient for the next appointment. Click on the Reserve button on the top right corner to open up the calendar appointment. Please note, the system calendar will automatically open up to the next appointment date based on the pen color. Only the SOPD nurse and the medical officer can revise the date using the Reserve function. Select the relevant appointment date for the patient, then tap Yes to confirm. Step 7. Updating the patient queue. Tap on the nurse icon to update the queue after the patient triage has been completed. The icon will change from orange to green, indicating that the nurse's consultation has been completed for that patient. This change will then be reflected at the Reminders appointment page. Please note, if the patient is to see a foot care nurse on that same day, the foot care nurse will directly log into Sova Ni Bula system, view the patient from the appointment reminder page, select the patient to assess, then visit the patient profile and add the foot care assessment notes directly. The foot care nurse is not required to update the queue. The queue system provided in Sova Ni Bula is only to indicate the completion of triage by the SOPD nurse. Once a patient's triage has been completed and the queue has been updated, you may now return to the reminder page by tapping on the back button. Since we are still on the search record, ensure to tap on the magnifying glass, reset the search, press confirm to view the other patients. Thank you for watching. Vinaka.